Guys, welcome back to Medical Coding with Blue. Today's episode is all about how to take a test drive in the health information or medical coding field. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So a lot of you have written in and said, well, Blue, I'm not ready to commit just yet to going to school and investing all of this money. Is there a way that I can sort of test drive what a career in medical coding would be like? Yes, there is. So here we go. All right. So I will say this also. There are some places that will allow you to get hired even though you have had no training in medical coding. Okay. I've seen that before. I've seen people that say, well, I applied for this job and then, they needed a coder, but they didn't really know about coding and things like that. But they said, are you willing to try this? And people are saying, yeah. And so that's how they were able to get in. So it's not impossible to get a job in medical coding without being certified. However, there's going to be a lot more on your plate that you may or may not be ready for. Okay, so while it is possible, it's just one of those things that you have to be on the lookout for. Okay, so but yes, some do and some do not. Some areas offer that and some areas do not. So it really all depends on where you are. But I would look at the job listings to see if there's, somebody that says, well, we need a coder and you're not required to be certified yet, or coder must be certified within 2 years. And if that's the case, then do your best to try to get that type of job because while you're not certified yet, you have the opportunity to be able to start and really kind of get that exposure without having to commit to going to a school yet and being certified. Now, I will say that it is important for you to at least understand medical terminology. If you're going to attempt this, understanding medical terminology is really important. But there's a lot of people that resist even learning medical terminology, even as a medical coding student, which I think is ridiculous because you're setting yourself up to fail. It's not a good thing to say, oh, well, I just want to learn how to look up codes. It's not about looking up codes because there's multiple names sometimes for certain conditions. And because of this, it can get very confusing very fast. And so again, you have to be good at medical terminology. So if you're going to go that route and you're going to apply, even though you have no experience, and if they're willing to train you, then you just got really lucky. Okay. But that's just one way to start. It's a long shot, but it is possible, okay, because I've heard of it. So the other one is starting off in medical billing. Now, medical billing, you are not going to be required to do any of the coding because basically you are taking the codes that are submitted to you in your department and then you're sending them to the insurance company for payment, okay? So the answers are already going to be done for you, right? The diagnoses are going to be selected, the procedure codes are going to be selected, and the great thing is that about billing is that there's no requirement for certification. All you have to have is a high school diploma or a GED. That's it to start in medical billing. So I think that's a great way to get yourself some exposure to the industry and see what it's really like and see all the things that it has to offer, because sometimes when you get these medical billing positions, your employer may offer tuition reimbursement and that kind of thing. So if you're willing to get further educated, sometimes they'll be willing to pay for your exam, so that's just one of the perks of, being in a medical billing position, but that's something that you have to ask the employer. But again, you're going to have lots of filler for your resume once you do. If you do decide to go into medical coding, you can tell them obviously that you've been a biller before, that you've had exposure to the electronic medical record. You know what looking at a document is like, and you know about the modifiers and the procedures and the diagnosis codes. So, and along with all of the insurance regulations, which makes you a lot more valuable and will put you at the head of the pack when it comes to applying for positions as a brand new medical coder. I'm just saying. So it's about making good use of your time in the time you're trying to decide if this is a career field for you. But I will say this also before I go on. Don't overthink the career field. Don't overthink the career field of medical billing and coding, or even just being a medical coder, because everybody's going to go through billing in their program. It does not mean that you have to be a biller. Everybody has to know about reimbursement because we are all tested on reimbursement. The 4 main medical coding certifications, the CCS, the gold standard of medical coding credentials, that's a certified coding specialist. The CCA, the certified coding associate. The CCSP is the certified coding specialist physician based. And these are all with the American Health Information Management Association. And then there's the American Academy of Professional Coders. And they have their flagship credential, the CPC, the Certified Professional Coder. Now, you just need one. Any one of these 4. And when you are deciding to go, which one you're going to go to, all you need is one certification, and that's it. Okay. So again, having this time of having exposure already to codes in the industry, and maybe being lucky enough to start off in a coding position without being certified, but you have to be certified within a certain amount of time, is a good thing. Okay. And again, all you need is just the one. All right. But this time beforehand is going to be great for your resume. Okay. And a lot of people will do this. They say, well, I started off in billing, and then I used that time to learn about the industry, and then I decided to go to school for medical billing and coding, and now I'm a medical coder. It's totally possible, guys. And that's just a way for you to sort of get your foot in the industry, to really look around and see if you like this field. Because this field does require a lot. It requires a lot of reading. It does require you to write. Now, there's going to be times even if you're in any of these other positions, right? Whether you are a coder without being certified, or if you're a medical biller, there's maybe times when you're going to have to send emails. And of course, these emails need to be written in proper English with good grammar. This is very important. And with all of the proofreading things out there like Grammarly and even on the systems itself with Word and everything, there is no excuse for writing improperly. Okay, none at all. Okay, so you have to learn to work with that. And as far as like typing speed, we are not about typing. We are about entering in codes, but we are not about full-on typing. So if you type a little slow, it's okay. But again, make sure that when you are communicating through email or something, that you're writing in proper English. I have seen coders, actual certified medical coders, write in horrible English. There's no excuse for it, guys. Absolutely none. No excuse at all. And to me, I have little to no patience for people who do not respect the written word. I love books, okay? I love books, and I'm all about coders showcasing themselves in a proper way, because these doctors, that's something else you got to know. These doctors have little to no patience for people who waste their time. So you always want to make sure that you're starting to develop yourself as a good medical coder even before you're certified, even before you try to get into the field. You want to go ahead and have that good mindset, and you want to have that professionalism when you're out there in the workforce. So again, writing properly is really important. And some people will tell me, Blue, English is not my first language. The standards are not going to be different for you because English is not your first language. It won't be. All right. So there's a lot of people who say English is not my first language, but I learned. And there you go. And some of them who write me say, Blue, English is not my first language and I'm nervous. I could not tell because they wrote so well. And I don't know if it's because they took advantage of like Grammarly or, any of those other ones, but that's good because that tells me at least you know how to use the tools, right, that are out there and available to you. Okay. So again, it's about reading, it's about writing, it's about doing research. Okay. So the next position that I want to talk about that you can use in this time where you're trying to figure out if medical coding is a career field for you is charge entry. Now, charge entry is, much like billing, but charge entry, they're going to give you the codes and, of course, the documentation. These are the codes, and then you just have to enter them in. And so that's going to expose your brain to, okay, these are the codes that go with this, and this is what they reported with for this type of procedure and this type of condition. So that's going to help you to say, okay, and then now you're going to start learning about these things. So all of these things, again, filler for your resume. And that's transferable for when you start, if you decide to start a career in medical billing and coding, because you're entering in ICD-10 CM codes. If they're having you do inpatient procedure entry, ICD-10 PCS, CPT codes, current procedural terminology, HCPCS level 2 codes, all of these things, again, are filler for your resume. And so it doesn't require you to be certified to do charge entry, all right? And again, it's giving you that exposure. And a lot of times when you get into these types of positions like medical billing or even charge entry, there's a way for you to transfer to the coding side once you, again, if you decide to do that, all right? But these, you guys have to know that they're not going to pay you what they would pay a certified medical coder, okay? And because these are those positions to sort of help you get exposure and to learn if this is for you. So the pay is not going to be the same, guys. So just look at it that way. And there's a lot of people that are concerned, of course, about that. And there's nothing wrong with being concerned with that. However, don't let the money for medical coding be a deciding factor for you. If you are after this career because you say, well, the pay is really good and that's why I want to do it, then you're going to be miserable the entire time you are a medical coder. I see plenty of people that are like this, and they end up hating it because it's just for the money that they're doing it. And yes, you should enjoy what you do. You are allowed to enjoy your career. And of course, it will reward you. But again, at the same time, if that is your sole motivation for getting into this industry, then that is the wrong reason to get into this industry. Okay? This industry is about learning. This industry is actually also about helping people. Because while you are not in coding yet, these supportive positions, medical billing, being certified without being a coder without a certification, doing charge entry, all of these positions are supportive in the health information cycle, okay? And these are needed positions. And so because of this, guys, we help other people. We help the patients, even though we never see them, we don't touch them, we don't have any sort of conversation with them unless you're doing the billing side. But we still help them in the sense that we're sort of behind the scenes too. And a lot of what is supportive help basically is what is making the whole thing successful. These doctors are going to rely on us to know what we're doing. Somebody who's had exposure to the other side of the health information arena is going to be a well-rounded person. They're going to understand the nuances and everything from being in these different positions. And that's the best sort of person to have, right? Especially if you couldn't decide on whether to do this or not. But again, don't overthink it. If you're going to go for it, then go for it. If you're hearing other people say, well, it's impossible to get a job and blah, 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 I invite you to take time to go through my videos where I'm talking about alternative job positions for medical coders, how to formulate your resume so that it does get that attention. Because that's a mistake. That's the number one mistake that a lot of new medical coders make, is their resume is messed up. And of course, no one wants to call them. And then they're blaming the fact that they're a brand new medical coder. Or they're only seeking out entry-level positions. You can't do that either, guys. Once you're certified, this says that you know. And then you should apply for everything, even though they are asking for experience. You still apply anyway. At least that's just my advice anyway. So, continuing on. And this is the last position that I'll talk about for today. But one of the other positions that will give you that exposure to codes and coding is perhaps a secretarial position. Now, you have to be very careful when it comes to secretarial positions in the health information arena. Now, I would not recommend secretarial positions for newly certified medical coders. Why? Because when you have training and when you have your certification and everything like that, if you're a really good secretary, they're going to leave you in that secretary position. Or they're going to overwork you and say, okay, well, this person is also certified and they are a really great secretary. So again, we're going to overwork this person. So, but if you don't have the training yet and you want to see if this is something that you want to pursue, and you apply for a secretarial position and they say, well, you have to select the codes and then you just report them. And these are the codes that we select from. These are the procedures that we select from. That's sort of doing the coding. It's sort of giving you that entry sort of feeling if you want to do this or not. So that's a good way to go for someone who is not certified. Let me say that again. If you want to apply for a secretary position and you are not certified yet, you want to see if this is something that is going to work for you if you decide to pursue this, and that's a task that they have the secretaries do, and make sure that it's that and not just reception, because reception and secretarial work are two different things. Reception is you're just basically a greeter, and then you let the people know and things like that that they're there and that kind of thing. With secretary, you're doing a little bit more of other things too. You're working with the medical records, and you're working with this, and you're working with that. So again, the coding may be a part of that, but make sure when you are applying for that job and you're doing the interview that if this position involves any type of coding, okay? And if it does, then you can say that's fantastic because I am looking to start a career in medical billing and coding. They don't need to know that you're still on the fence. They don't need to know that. If this is going to be your way to get in and for you to get that exposure, then you do what you have to do to get that position as far as what you say. They don't need to know that you are indecisive right now. They don't need to know that. They need to know, are you going to show up? Are you going to do your job to the best of your ability? Those are the things that they need to know. So, but that's just what I would say. It's not being dishonest because you are there to do a job. And they are not there to hire a medical coder. They're there to hire a secretary. But this secretary also does the coding. And that's what you want to get exposure to. And again, that's going to be great filler for your resume. I've written resumes before for medical secretaries who have had to do that. And even though they are just selecting from a list, and this is basically what sometimes they're told that these are the codes we want, and other times it's like, okay, you're going to select these based on what's here. That's what they do. And again, that's great filler for your resume. Okay, so that's just what I would recommend if you're wanting to take this career for a test drive. There's so much to it, guys, though. I will tell you that. And I'm surprised how many times I'm told I didn't know it was this much reading. Well, I mean, you're looking at medical documentation. That's how we get the codes, But again, it doesn't require you to be a fast typer. You're just basically going to be entering in codes. And they're alphanumeric codes. So basically, you're going to be using a little number pad. I call it 10 key by touch, but every time I do, I get people who look at me like I have 3 heads. 10 key by touch is a little number pad on your computer. Now, sometimes computers don't have that anymore, which I think is weird, but whatever. But it's just basically like a little calculator with numbers, and all you have to do is just push those numbers in, when you're entering in the codes. These codes are alphanumeric, like I said, and so you're going to have sometimes letters in between these numbers, It really all depends. But this is a great career field. It's great for expanding your knowledge base. It's great for expanding just you as a person, professionally, developing personally. That's what this field does for people who take it seriously and for people who are truly interested in it, I mean, it's a great thing. And it welcomes people of all ages and stages of life. Sometimes people are just fresh out of high school. They don't really know what they want to do with their life, but they heard about medical billing and coding, that it could be a stable field for them. And then they decide to pursue it, Same thing for people who are older, and sometimes they're retired and then they say, well, I still want to work, or I still want to be able to use my mind, or I wanted to pursue medical billing and coding many years ago, and now I can do that. I have the flexibility to be able to do that. So if you are in your 50s or 60s, trust me, you are in good company. There's a lot of people that watch my channel that are in their 50s and 60s. So, and they're pursuing this. you know. And so I've seen it many times where they get so excited when they pass, and they get even more excited when they get their first job. But they get it by being tenacious, and they get it by being active out there. They get it by paying attention to detail, going through my videos and listening to my advice, my many advices out there. I try to be as descriptive as I can in the job titles, in the video titles, so that way you guys know what's in that particular video. If you don't want to sit there through the whole thing, obviously you can always hit fast forward on the voice. But I'm a Texan. We talk, and that's what we do. I do not believe in little short messages, because I believe things like TikTok are contributing to people's ability to not have a long attention span, and I don't think that that's good. I think that it's important to have a long attention span, so I will talk as long as I talk, because I'm not going to, promote those quick things. That's why you will not catch me on TikTok. That's why you will not catch me doing those little short clippy videos. I don't do that. I talk, I bring the detail that you want to know, and things that you didn't even think to ask. That's what I do. And I will always be that way. And to me, it's been pretty successful, because I have over 25,000 organically grown subscribers that I've gotten all on my own, without the help of any SEO experts out there, by the way. I'm just saying. So, I will continue to be myself. I will continue to be here, and hopefully sharing this message with you, and hopefully this helps you. So if this video helps you, I hope that you will like, subscribe, and share, and I will see y'all next time. Bye.